Hi, I'm Sharon Price from Beverly Medical Center, and I'm here today with the founder, Dr. Beverly Goode-Kanawati. Hi, thanks for joining me today.
Hi, Sharon.
So we wanted to share a little bit with people about your background. Tell me a little bit about why you decided to become a doctor.
Well, that's a really kind of a long story, why I want to become a doctor altogether, but I actually decided that when I was 13 years old.
Oh, wow.
And I was a junior counselor in a camp, and I had been taught first aid, and I helped a small child who hit their head and was bleeding, and I took care of it better than the mom, and the mom panicked, and I put pressure on the wound and got it to stop bleeding, and I thought, I think I'd like to help people. I kind of like this medical stuff.
Great. Where did you go to medical school?
I went to medical school in Iowa.
Oh, now you're from the Midwest, right?
I'm from New Jersey originally.
Oh, a Jersey girl. Okay.
Yes.
All right, so you grew up, this is where you learned your young doctoring skills.
Kind of, yes. Okay. Yes. I'm sure I learned some of it at being a brownie and a Girl Scout, too.
Okay, well, you always seem prepared. So
Yes.
You went to medical school in Iowa, and then you've been in practice a long time, but how has your perspective and your approach changed over that time?
Well, I think when you're in training, you go to medical school and then you go into internship, etc. You learn a certain set of basic medicine and about how to identify diseases and treat serious and acute diseases, and then somewhat learning chronic diseases. So actually, there's more training involved with teaching you acute diseases than chronic diseases.
Right.
But it's really important to be able to identify acute disease and to treat acute disease, of course, as well. And then when I got into practice, I found that a lot of my options were really limited with medications and surgery. There was a lot of people that fell, in the cracks who were not getting help with those medications or with those surgeries or with any other, more invasive procedures. And I started looking towards other avenues.
Okay, so what are some of the other things you do? I know you do more of an integrative or holistic approach. What does that include, and how do you think that helps?
So one of the main things that we do in our center, and as well as myself, is looking for the cause of the underlying disease. So that's really, really important, instead of just giving somebody medication. So for example, if somebody has asthma, we're not going to just say, okay, here's a couple of inhalers and some medication and maybe a few allergy shots. We're going to look in their environment. We're going to look to see, do they have food allergies? Do they have environmental allergies? Are they being exposed to molds or mold toxins? Do they have environmental chemicals, maybe a leaky gas stove or fireplace that could be causative of their problems, as opposed to just giving them a medication to relieve the symptoms.
So it sounds more like detective work up front, a lot of trying to unravel what's going on and not just treating the symptom.
Exactly.
Okay, so then once you have a really good understanding, I know you collect a lot of data, maybe a lot more than people are used to. So you do a more extensive amount of testing, it sounds like.
Yes, so we test for a lot of different things. Now, we don't test everybody for everything, but given what their particular medical issue is what we test for.
Yeah.
But we do have a basic set of tests that we do believe that everyone should have, especially in this day and age when cardiac disease, for example, is one of the biggest killers of not just men but also women. I'm not sure if it's number one, but it's close. And so we check everyone for cardiac markers, and there are a number of significant blood tests that you can do that insurance covers, which is great. That let us know if that person is at risk for cardiovascular disease, and then we also know what to do about it once we get those markers.
Well, I think that's kind of a hallmark of your practice, isn't it? The idea of preventing disease and not just treating after the fact.
Exactly.
Yeah, so what does that look like? Because I think, so on the front end, you do the detective work and you look at the whole person. But then as you're working with someone, as you mentioned, it's not just a medication. What are some of the other things that come into play?
So wherever we can find causation, so a lot of times the cause of a disease is a nutritional deficiency.
Okay.
So something that sounds like really difficult to treat, let's say somebody who has kind of a mild cardiac arrhythmia where they get PVCs. A lot of people know what PVCs are, or PACs.
What does PVC stand for?
It stands for premature ventricular contraction.
Okay.
But basically it's an extra beat or a skip beat. That really has to do with two things. One is mineral deficiency. So your electrical system runs on minerals. If you don't have adequate minerals, in particular magnesium and potassium, which most people are deficient in, the majority of people are deficient in. So if you look at intake studies, it'll show that people don't get enough magnesium in their diet. They often get enough potassium, but for a lot of people it seems to be inadequate.
Okay.
So if you replenish the potassium and magnesium, the PVCs disappear. That's a wonderful thing. Now, you also have to look at and make sure they're not getting too many stimulants,
right,
like caffeine or nicotine.
So you're really looking at the whole lifestyle,
Right.
the diet,
Right.
Supplements, everything else, all the aspects that might lead to a condition.
Exactly.
Okay, well, great. Well, that was really, thanks for sharing a little bit about your practice and your background. It's been great learning more about you.
Thank you very much.